welcome to the ICD-10-PCS Coding Series. If you are new to the channel, subscribe and follow the playlist from the beginning so that you understand every concept thoroughly. This is part 24 of the Inpatient Coding Series, and today we will learn about the importance of root operations in ICD-10-PCS. I'm Vinay Kumar. I carry an overall experience of 2 decades in the US healthcare industry with vast experience in coding, auditing, training, and mentoring. I have helped many professionals in gaining knowledge and preparing for medical coding certifications. I'm dual certified from both AHIMA and AAPC with extensive knowledge in all the verticals of the revenue cycle management. At the end of this learning session, we will have a better understanding of coding extraction from the group of root operations. This is the first group we are talking about. We will also look at an example of coding from the medical and surgical section because the medical and surgical section is the major portion of the ICD-10 PCS. Now, as you all know, there are a total of 31 root operations in the medical and surgical section alone. And these root operations are divided into 9 groups based on similar attributes of surgical procedures. Today, we are looking at the first group, which talks about root operations that take out some or all of a body part. And there are 5 root operations in the first group: excision, resection, detachment, destruction, and extraction. We have already looked at the first 4 root operations in this group. Now, today we are looking at the root operation extraction, which carries a character value of D. Now, root operations are the most important aspect of building a PCS code. Remember, root operations always define the objective or the goal of the procedure. So, always read the definition of the root operations and compare the definitions to the actual procedure performed. Only then you'll be able to understand which root operation is applicable under different surgical procedures. Now, extraction. So, extraction is defined as pulling or stripping out or off all or a portion of body part by the use of force. So, forcibly pulling off or stripping out is extraction. Extraction is coded when the method used to take out the body part is actually pulling or stripping only. Minor cutting, such as during vein stripping procedures, these minor cuttings are generally included in the extraction if the objective of the procedure is met by pulling or stripping. Okay, now for extraction procedures, cutting used to reach the procedure site is also specified in the approach value. So basically, any sort of minor cutting should not be coded separately when the actual objective is to extract or pull off the body part. Now, these are examples of procedures that fall into the root operation of extraction: dilation and curettage or DNC, vein stripping procedures, phacoemulsification without intraocular lens implant. Now, remember, this is like phacoemulsification is nothing but a modern type of cataract surgery in which the eye's internal lens is emulsified with an ultrasonic handpiece, and the lens is aspirated from the eye. So this is basically cataract surgery. Okay, now cataract surgery without an intraocular lens implant is coded to the extraction as the root operation. Okay, but the same procedure, if it is performed with intraocular lens implant placement, the root operation would be replacement, since the objective of the procedure is to replace the lens. So you need to be careful. Phacoemulsification or cataract surgery without a lens implant is extraction. With a lens implant is coded as replacement. Okay, now similarly, non-excisional debridement procedures are coded to extraction as the root operation, but on the same other hand, Excisional debridement is coded to excision as the root operation. And another good example would be liposuction for medical reasons is coded to extraction as the root operation. But the same procedure, liposuction for cosmetic reasons, should be coded as alteration as the root operation. So basically, we are talking about the objective of the procedure. Depending on that, the root operation values keep changing. This is an example of coding extraction procedures. The patient has an ingrown toenail of the right great toe. A nail elevator is slid under the cuticle and the nail plate is identified. The right piece of nail is grasped with a hemostat and removed in one piece, pulling it straight out. The left piece of nail is grasped and removed in a similar manner. Next, electrocautery ablation is used to destroy the nail matrix where the nail was removed. So basically, there are two procedures that need to be coded in this example. One is extraction of the toenail, and the other one is the destruction of the nail matrix, which is electrocautery ablation of the nail matrix. Okay, so the first procedure would be extraction for the toenail. The second procedure would be destruction using the electrocautery. Two codes. Now this is the corresponding table that shows the extraction of the toenails. Section is medical and surgical. Body system is skin and breast because nails are considered part of the skin. Root operation is extraction. Body part is toenail. Approach is external. No device for the sixth character. And the seventh character is Z, which denotes no qualifier. So the code for the extraction of the toenail would be 0, H, D, R, X, Z, and Z. This is for the extraction of the toenail. Now, this is the corresponding table that shows the second procedure of electrocautery ablation of the nail matrix. Section is medical and surgical. Body system is skin and breast. Root operation is destruction. Body part is toenail again. Approach is external. No device for the sixth character. And the qualifier is Z, which denotes no qualifier. So the code for the destruction of the toenail matrix is 0, H, 5, R, X, Z, and Z. Based on the ICD-10-PCS coding guidelines, multiple procedures are coded if multiple root operations with distinct objectives are performed on the same body part. That is the reason two codes are assigned to this case, since two distinct root operations were performed. The root operation extraction is coded since the nail plate was pulled out, and the root operation destruction is assigned since the nail matrix, which is still part of the toenail, was destroyed by electrocautery. Okay, that's the reason I said the key point to remember in ICD-10-PCS, one of the most important guidelines, is you need to remember sometimes multiple codes are needed to capture all components or parts of the procedure. And approach values also play an important role. You should always select the approach based on where and how the procedure is performed on a body part. You'll find the online version of the ICD-10-PCS coding manual from this link that is provided by CMS. You can download it and use it for practicing as such. I've given the a link for the uh, online manual in the description of this video. So go ahead and check it out. Thank you guys. Thank you for watching. Please subscribe to my channel. It really gives me a lot of encouragement. And also follow the playlist from the series from the beginning so that you understand all videos properly. In the next set of videos, we'll talk about the second group of root operations from the medical and surgical section. I'm also planning on doing the CPT classes. Probably, within a week or two, I'll get started with the CPT as a separate series as such. Thank you.